Hi there. PAD, Peripheral Artery Disease, is one of the leading causes of amputations. PAD is essentially a medical condition in which the arteries that go down to the legs or to the arms, the periphery, are blocked in some way, and the blood flow is constricted. When blood flow is constricted, then the nutrient-rich red blood cells cannot get to the tissue in the arms or in the legs. When that occurs, the tissue cannot survive. It needs the oxygen that the blood is carrying in order to keep living. When ischemia happens, the constriction of the blood flow, then the tissue starts to die off. And when tissue starts to die off, it gets to the point where those limbs, those peripheral limbs, are no longer viable and must be cut off. PAD, thankfully, is easily treatable. It is something that can be detected very quickly through radiology and can also be treated through drugs or exercise or a diet plan. However, if your doctor or hospitalist does not actually find PAD or doesn't listen to the red flags that you are telling him or her, then that can pose quite a big problem, because the longer PAD occurs, the longer the blood is constricted, the longer limbs aren't receiving enough oxygen and therefore will die. PAD, the most common sign of PAD is actually walking pain, meaning when you walk, there is pain in your legs. That is the number one red flag that doctors should look at and then actually do testing for in order to make sure that there was not PAD occurring and therefore a possible amputation may not occur. If you or a loved one suffered an amputation and it was due to peripheral artery disease that wasn't caught, then you may have a medical malpractice claim. You should really speak to a medical malpractice lawyer. My name is Adam Funk. I am a lawyer that handles medical malpractice cases. I'd be happy to chat with you about yours.